We've been capturing discrete data for a very long time, so when Phytel came along to kind of help us with that, it kind of put things in a different perspective, because for so long, anytime we wanted something, the end user wanted any data, we were very reliant and dependent on our IT department, and they would run crystal reports for us, but a lot of times it would take 2 or 3 weeks to get a report back that we asked for, and then by the time you got it, the data really wasn't relevant anymore. So, I think one of the things that really helped us when Phytel came along is that it was real-time data, and then we could, the frontline staff could actually use it and implement it and adopt it into their day-to-day workflow. Well, Phytel really helps you to coordinate care just in a different realm than you were ever able to do just with your regular chart, whether it's paper or electronic chart. You're still just dependent on the day-to-day, who's coming in, who do I know about for today, who's on my books. I mean, basically our patient tracking was the doctor's schedule. So when Phytel came along, it just really changed the whole ball game, because now you have a way to look at not just your medical data, but because Phytel merges your billing data and your appointment data, now you can get very specific as to what do you want to do, who do you want to look at. I know who's coming in on a specific date or a specific week, but what do I need to know about those patients so that I can be prepared for them? So what Phytel really helped us do was coordinate better. We really went from being very reactive in our care, and I like to say that we act shocked when they show up. Although they've been on our schedule for 3 months, we still were in that reactive mode, that when they got there, we would then scramble to figure out, oh, what does this patient need? This is a 40-year-old white female with diabetes, and these are the protocols that this patient needs. And we would do that as they walked in. But with Phytel, that really gives us the ability to plan and to know who's coming in, what services they need, close care gaps before they get there, even get them to come in before their visit for labs so that the doctor can discuss what medical changes they would want. And it just changes the whole treatment plan for the patient. And I would hope and I would think that the patient's experience was better also, because we were prepared and we planned for their visit, other than acting very reactive when they showed up. What comes to mind is manual, paper, labor-intensive, and with Phytel, it's just now automated. So the word efficiency comes to mind. You just feel like you're better prepared. You're using technology in a way that's useful and meaningful to the patient and really driving their health outcomes. And that's what drives it all. That's what our focus is. Patient engagement, in my opinion, is the future of healthcare. I don't think you're going to be successful without engaging the patient. I think the days of just seeing the patient 3 to 4 times a year and then you don't think about them, you don't look at their health outcomes at all, I think those days are over. I really think that it is our responsibility to help them between their office visits, and the only way that I can see that happening is by having something automated that helps you identify those patients that are not at goal between their visits and reaching out to them, whether it's because they have labs that are due or they're just not at goal. So, you can reach out to them, and with Phytel, you have that automatic outreach that you can coordinate campaigns and send out to them and send messages to them between their office visits, based on either their health outcomes or that a service is due. We are working with payers in our area, and we do have a couple of payers that are doing some shared risk savings with us. So it's kind of new in Mississippi, but it's conversations that we're having. We know that is the future. I think our number one goal is to improve health, and I don't want to say payers don't have that same goal, but they also have a financial risk and they want to reduce their expenses. And so if we can help the patient be seen in the lowest cost setting, that's what we want to do. And we want them to be seen in a clinic instead of an ER, which is just a higher cost setting. With Phytel, it really just kind of pushed us to really look at what are the standards of care and come up with protocols and standing orders and give those to nurses and set those expectations that you are part of the care team, you're an extension of the physician, and to go ahead and get things in motion even several days, a week, 2 weeks before their appointment. With our diabetes project, one of the projects was identifying the high-risk patients, and we identified high risk by A1C over 9. So we just we just created a PI project, and we used Phitel to identify when those patients were coming in. We had a baseline of 75 patients, and within 3 to 4 months, we were down to only 39 patients with an A1C over 9. And so I guess Phitel gave us a different starting point, so we knew who was coming in. We knew what was going on with them. We were able to close care gaps. We set in motion just protocols and an action plan of, if the patient fits this criteria, these are things we're going to do, including visit frequency, because there was variation between the physicians. And so we have seen, by following some standing protocols, that we can really reduce variation. I don't see how we could have done that without Phitel, because we didn't have a way to identify those patients. It would have just been wait for them to come in, and then once you're in their chart and you see what their last lab was, then you identify them. And usually the nurse would not be looking to see what was their last result. You know, the nurse would probably know they were diabetic, but that's not inherent for the nurse to go look to see are they at goal or not. But with Phitel, that gives the nurse a different dimension and a different responsibility, and really allows the nurse to be part of a care team. And I mean, in our area, I know the nurses just feel like they really make a difference. They feel like they're empowered, that they're impacting patient care, and they don't just feel like they're doing vital signs and updating a chart. I think you should consider implementing Phitel and adopting it as one of your strategies for population health. It's going to allow you to go from manual processes to automated processes. It's going to allow you to really understand your population, define that population, understand who's at goal, who's not at goal, and it's going to help your staff to do the work in a much more efficient way.